Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Namaste, sir. We have been, over the last week or two, working on injuries. Could we take up wounds this morning,
sure.
Open wounds? Good.
Wounds are very common by accident or whatever. And in our surgery book, which is very popular, Bailey and Love's surgery book, the top caption on the chapter on wound is healthy tissue is the best antiseptic. So there is system in our body which takes care of trivial wounds.
I have always found this to be so.
Yes. So we consider that first of all the tissue should be healthy. So healing is very fast.
Yes.
Then we have, if it is open wound, a plant you must have heard about, Calendula officinalis.
Yes, certainly.
Is very good plant extract which helps in early promotion of healing. And in homeopathy we prepare mother tincture. That Calendula officinalis, we chop it to the fine pieces and dip it in 95% alcohol, what we call extra neutral alcohol, or in British 60 OP, overproof alcohol. We dip it for 8 to 14 days and then filter it. That is what we call mother tincture. And this tincture we can use for external application for cleaning the wounds. So whenever there is open wound, we have to ensure that there is no foreign body or sand or some particles lodged inside. So we have to clean the wound and go on spraying Calendula officinalis as antiseptic and allow the wound to heal.
So the calendula is only an antiseptic, not a healing, or is it also healing?
Antiseptic in the sense, actually healing is a very complex process. That body has a mechanism to even prevent superadded or secondary infections. So calendula promotes in healing and again prevention of what we call entry of bacteria or multiplication of bacteria itself is a part of healing. So it promotes even the scarring, the lack of, lot of blood supply is drawn to the part, even the pain is relieved and the wound heals. We have to ensure that if the cut ends, two ends are held properly, so what we call a temporary immobilization in that part will definitely help in early healing of wound. So we have to dress it with spray with a Calendula officinalis mother tincture. This mother tincture has around 63% of alcohol in it. Because it is prepared in alcohol, it's a stat. The advantage of it is that it itself doesn't get spoiled. You can keep it for years together safely. Means no fungus can grow in it. Only one disadvantage is it causes little burning when we apply. But that's only for a minute or so, and as the alcohol evaporates, rather it gives a cooling effect also. So we always advise Calendula officinalis to be sprayed on the wound. Sometimes with the open ulceration, there is always a cut where the nerves also are cut and injured. So we suggest hypericum as one more remedy which can be spread if we find that the wound is a bit deeper. But mere lacerations, where only the skin gets peeled off and bleeding is there, mere calendula is fine. If there are wounds, especially at the tip of the fingers, where the blood supply itself is lacking because it's a terminal part of the arch of blood supply, there we add symphoitum mother tincture, which helps in attracting more and more blood supply for healing. So injuries to toes, hypericum, symphoitum and then calendula, these three things we add. But homeopathy has wonderful remedies in the form of these 3 tinctures.
And therefore, you never recommend covering the wound unless
Yes.
it's very deep.
Yes, unless it is deep, as well as if it is at vulnerable place and if you are moving about. But if you are confined to your house, we just suggest, in India, lot of flies and all around. So we suggest person to sit in mosquito net, so flies and all are not reaching the wound. Open is always better, because dressing itself causes stagnation of fluid. Then the stagnation of fluid there in the form of, and this debris, or what we call a scab formed on the wound, it works as a protection. So you don't need to remove that scab, because if the bleeding, if it is cleaned properly, little bleeding will definitely lead to a scab formation, which itself works as a protection for the wound. So it's like a natural dressing you get. So, but if you are going out and if the area is vulnerable, then you are allowed to dress so that it is protected. Otherwise, dressing is not necessary if it is, you are not going in vulnerable places to attract more dirt or mechanical injuries.
Right. Thank you, sir.